Whose children?
After days of demands for data to support Alberta's decision to eliminate almost all of the public health measures for COVID-19, Alberta's Chief Medical Officer of Health instead releases an op-ed. The 1.5-page letter starts with an apology over the way Hinshaw communicated the planned changes that has caused confusion, fear, and anger. There will be no more widespread testing and tracing, and COVID-positive people will not be required to isolate in Alberta. Hinshaw writes that she believes people with COVID will self-isolate out of compassion for others, and says the resources directed at COVID has come at a cost of not fully working on other threats like syphilis and opioid deaths. She calls the measures extraordinary, adding mandating isolation before the vaccines was necessary. But it's also incredibly disruptive. It could only be justified when the risk was unchecked by vaccine protection. Hinshaw also mentions children, most of whom are heading back to school unvaccinated, saying kids have a much smaller risk of severe outcomes. Reaction to her op-ed was swift online. Most of the comments criticizing the doctor for the lack of science in the letter. This pediatrician tweeting, "We're not yet at the stage of living with COVID. That implies that it's an endemic. It's not. We're still at a period of exponential growth." Another critical of the doctor, likening kids' sports injuries to catching COVID. Meanwhile, Alberta's opposition demanding an immediate restoration of COVID-19 testing, tracing, and isolation, saying ill workers could risk losing federal sick pay benefits.
For Canadians, if your public health orders say that you need to stay home when you're sick, you qualify. In Alberta, we won't have public health orders that say you need to stay home.
In Edmonton, Rochelle Sufi, City News.